What's up, guys? Your boy Mike, aka New Yorker in the Philippines, and today we're going to discuss healthcare options here in the Philippines, mostly for travelers and expats. So if you're watching this video, you're probably getting ready or thinking about moving here to the Philippines. One big question everyone asks is, what am I going to do if I get sick? What am I going to do if I get injured? What am I going to do for healthcare? Especially coming from America, where you basically need health insurance to do anything. There's going to be a lot of questions for new travelers. So in this video, I'm going to be answering your questions in regards to everything healthcare in the Philippines. Alright, so first off, you guys are probably wondering, what's the quality of healthcare here in the Philippines? Because even if you have insurance, if the quality of the hospitals and stuff sucks, it's not going to do you much good, right? So I have some good news and some bad news when it comes to healthcare in the Philippines. Let's start with the good news. So the good news is, depending on where you are, if you're in a bigger city or a bigger province, for example, I'm in Metro Manila, there are a ton of very good hospitals available. So in Metro Manila alone, there's St. Luke's Medical Center, there's Makati Medical Center, there's the Medical City, just to name a few. To give you an idea, these are going to be Western level hospitals, or maybe even better compared to what you have in your home state. For example, St. Luke's Medical Center is part of the Mayo Clinic network, which is the best hospital in the world. So it's prestigious, it has basically everything you can need. And this goes for a lot of the big hospitals here. The doctors as well, I've seen specialists here. The quality is good, the appointments are very thorough, they give you a lot of time, unlike in America, where you're in the office for 2 or 3 minutes after waiting 6 months to see a specialist. That's not the case here. With every specialist I've been to here, which is only a few, I've gotten appointments that are around 20 minutes, and this is all for around 10 to 20 US dollars compared to back home, where if you're going to see a specialist without insurance, good luck, it's going to be quite expensive. So now for the bad news. The bad news is the healthcare here is not as evenly distributed as far as quality goes as it is in America. So for example, obviously in America there's good and bad hospitals too, but for the most part, if you go to an emergency room, you go to a hospital anywhere in America, it's going to have some kind of minimum standard, right? In the Philippines, it's going to be a bit different, right? So I hear a lot of expats hating on Metro Manila. You see it all the time on YouTube, on the forums. People will say, oh, as soon as you fly in there, next thing you want to do is fly out of there because, you know, Metro Manila sucks, blah, blah, blah. Go to the province, go to the islands. And yeah, going to the province, going to the islands is beautiful. It has a lot of benefits. But when it comes to healthcare, that's not really one of them. So what I'm saying here is, depending on where you're at in the Philippines, the hospitals could be very good, or very bad, or even non-existent. So think about that think about that when you're considering where to move. Because if you're in the metro area, if you're in Cebu City, if you're in Metro Manila, if you're in, you know, Baguio City, some of the bigger places, you're going to have good options. If you're in a smaller province living in a very rural area, you're going to have to check, because like I said, the quality drop-off is going to be very extreme here. That's going to be a lot of things in Philippines. There's a lot of extremes. And that might not be a problem for you, or it might be. It depends on your standards. It depends on, you know, what you value as far as like that goes, right? Everyone's going to be different. But what I'm saying is that there is going to be a lot of difference in quality. It's not going to be like a big Western hospital everywhere here. You know, this is a developing country. There's some areas that are more developed than others. Just keep that in mind when choosing where to live. Alright, so now let's dive into the nitty-gritty of health insurance and what options you have available. So again, the good news is there are some options available. The bad news is they're not going to be the options that you're using back home, right? So people asking me about Medicare, they're retired. That's not going to work over here, right? That's insurance for America. It usually doesn't carry over. But there are some options. And let me tell you guys about the best insurance in the Philippines. And this is no joke, even though it sounds like I'm trying to be a funny guy. I'm not. The best insurance in the Philippines is going to be cold hard cash. So this is going to probably blow your mind, you know, because it's the total opposite of everything we know in America and Canada, other countries, right? Where if you don't have insurance and you go to a doctor, you go to a hospital, good luck, bro, because it's going to be quite expensive. It's going to leave you in probably even a debt, right? But in Philippines, things are affordable and cash is king. This is good and bad. So let me tell you why it's bad first, right? So in America, we like to bash the healthcare system, but guess what? If you get ran over by a car outside and someone drags you to the hospital, they're going to take care of you, right? Even if you get a big giant bill afterwards, they're going to make sure they take care of you first, and then you're going to get the bill after. In the Philippines, it's not always like that. So some hospitals will take care of you regardless, but a lot of the times it's cash first, right? So if you get in a motorcycle accident, God forbid, all seriousness, if you get some kind of accident, right, and you go to the, hospital, you don't have cash on you, they will turn you away sometimes. And that's not to badmouth the Philippines people or anything like that. It's just the system here, right? Like in America, like in any country, right? The system, the government is different from the people, and that's how it is here, Cash is king. So make sure you have cash on reserve. That would be my number one thing, right? Even if you're spending a lot of money on healthcare plans, maybe reconsider, because having that cash is going to be your best bet. Number two, let's talk about when it comes to actual insurances, what you can do over here. Okay, so one thing you could do is you can get a travel insurance. Some of the big companies for travel insurance would be Cigna, it would be Allianz, and I'll have links to those down in the description below. But these two companies will offer you basically plans that work outside of the USA. Sometimes you can get the plan designated for anywhere else in the world, or you can get specifically for Philippines if you're coming here. If you get specifically for Philippines, it's going to be cheaper because the healthcare is cheaper, right? So keep that in mind. The bad thing is these plans are kind of expensive. For me, as a 30-something-year-old, the plans were quoted around $250 to $300 a month. That might not sound expensive depending on who's, watching this video, but for me, it was pretty expensive. Also, these plans do not cover pre-existing conditions. So if you're coming over here taking a medicine for something, you have a pre-existing condition you want to have, that insurance for, it's not going to be an option. So keep that in mind. But those are two options. Those are two reliable companies if you want to do the travel insurance option with the big names. If you don't want to do that, the thing I recommend is checking out healthcare options here in the Philippines. So this is where this video comes in handy, right? Because like you, I was watching these videos, I was wondering what I'm gonna do. How am I supposed to know what they have in the Philippines, right, if I'm in America? But I'm gonna tell you guys, I'm gonna run you through it, right? So there are HMOs here, right? Just like you have HMOs back home, which are just basically traditional insurance plans, there are some HMO companies here you can get as a foreigner or as an expat, whatever, right? So I'm gonna have some links below. Some of those include Pacific Cross, MaxiCare, MediCard, just to name a few, right? So last year, let me give you an example. I used Pacific Cross. For a year, an annual payment, I paid $700 for healthcare. What the healthcare included was basically anything I would go to the hospital for and be admitted into the hospital. So I didn't get doctor's appointments, I didn't get medications, I didn't get any of that. I just got insurance that covers me if I got admitted. So you might be saying, well, what am I going to do for the other stuff? You know what I mean? But again, it's different here in the Philippines than it is back home. Basically, you want to have that insurance that covers the emergency stuff, the big stuff that you just don't have the cash for right away. As far as doctor's appointments, as far as your medicines and stuff like that, majority of that is going to be very, very affordable, so I wouldn't worry about it too much. So if you're watching this video worrying about having insurance for doctor's appointments, having it for medicine, I would not worry. I will go over the cost of that, but just talk about insurance a little bit more. So like I said, I'm 30-something years old, and the insurance was about $700 annually, which is pretty cheap. It's going to depend on, your age, your health, etc., but it's quite affordable overall. Besides HMOs, there's also some other nice options that I really like about Philippines that we don't have back home. One of those things is a company called MaxiCare. So again, I'm not going to say this every time, but I will have links below for all these companies I'm shooting off so you can check them out yourself. But MaxiCare is a company that offers basically prepaid insurance cards, right? So there's one called ER Ready card. So this will run you about $100 United States dollar, right? So $100 and you get about $1,000 of insurance coverage. So basically, this is like you go to the gas station back home, you get a prepaid debit card, a prepaid Visa, except it's for insurance, right? So you pay $100, you get $1,000 coverage. When you go to the hospital, you just give them the card and it will cover anything up to $1,000. The nice thing about this card is that it does include pre-existing conditions. So you might be thinking, what am I going to do with $1,000 of coverage? But in Philippines, $1,000 of coverage in the emergency room especially goes a long way, right? It goes a long way compared to back home. The nice thing about these cards is you could use them as like supplementary insurance cards, right? So for example, one of the things we talked about before was the HMO. So say you have the Cigna or you have the HMO here, then you get this card on the side. All of a sudden you're starting to stack up different insurances, you're starting to stack up coverages, right? In addition, for $100, like I said, you're getting $1,000 worth of coverage in the emergency room or hospital, plus you're getting other benefits. So MaxiCare here is a big medical company and they have clinics around the Philippines. So if you get this card, you get all the stuff I just talked about, plus you get unlimited consults at any MaxiCare clinic. This is legit. I used it last year. I still have this card now. I think it's a very good value. So basically, you go to a MaxiCare clinic for a doctor's appointment, you show them your card, and boom, you have free doctor's appointment, right? Again, you have to go to a MaxiCare clinic, but if you're in the right area, they're going to be pretty plentiful, so it's not that big of a deal. So yeah, overall, like I said, $100, you get $1,000 of coverage, and you get unlimited doctor's appointments in the clinic. You can't beat that, right? So in addition to the card I just mentioned, MaxiCare also offers a card for any kind of basically blood work, diagnostics, x-rays, scannings, ECG, stuff like that. So that card is going to be about $150 and it covers all your diagnostics for 1 year at any MaxiCare clinic. Again, only at the MaxiCare clinics, but still $150 for a year's worth of diagnostics is also a good deal. So now we're starting to have more options, right? So all of a sudden, right, if you had that HMO, $700, right? Let's call it that for mine. Then you have that other card for emergency room, $1,000, right? So now we're at $800. Then you have another card for $150 for diagnostics. We're at about $1,000, right? And for $1,000, we're having an HMO plan for full coverage. We're having an emergency room card for $1,000 of coverage. And we're having a card that's covering diagnostics and doctor's appointments at a clinic. So now the value is starting to add up, right? We're spending $1,000, but we're getting all this coverage, right? So you need to go to the hospital, you need to go to the ER, you need to go to the doctors, whatever it is, you have something to cover you. So again, you're not without options here in the Philippines, right? It's not going to be like back home, but the stuff I'm saying will cover a lot of stuff. So let's look into that. Slow down, everybody calm down. I know it's very stressful when you're moving to a new country, especially if you have a pre-existing condition. I actually do, so I know what it's like. If you're getting older and you're worried about your health, you know, I understand that fully, and I hope this video so far is helping you, but let's relax, chill out. There are options, and we're going to get into more stuff as the video goes on. So next, I want to talk a little bit about, next I just want to talk about the price of doing business, right? The price of healthcare here, what the things actually cost. So if you're coming from America, you're coming from Canada, you're coming anywhere, you know, in the Western world, you probably have an idea in mind of what things are going to cost, and I can assure you that price you have in mind is probably going to be quite a bit higher than they actually do. So again, that's the good news, right? So let me walk you through some of my experiences, and again, these are just my experiences. I cannot talk on every place in the Philippines as far as like one price goes. It's going to depend on the hospital. It's going to depend on where you live, what you have to get done, all that stuff. But for reference, I am in Metro Manila, which is considered one of the more expensive areas here in the Philippines. So you can use my experiences as a baseline example. So last year, unfortunately, I was having some issues, and I did have to go to the emergency room. I had to go to the hospital a few times to get stuff done, right? So let me just walk you through some of the things I got done and then some of the prices. You can have a reference point. So I was having a problem. I have an irregular heart, you know, regular heartbeat, not a regular heart. I guess it's irregular, but yeah, a regular heartbeat, and I had to get some things done, including like ECGs. I had to go to the emergency room. I had to get x-rays. So I can give you like the prices of that kind of stuff. One thing though I want to mention is that I really think that the prices fluctuate a lot depending on where you go. Because one time I went to the emergency room at one hospital and they wanted 50,000 pesos before they even seen me, which was about $1,000 USD. And then another time I went to the emergency room and I got everything done and I left and it was $100 USD. So I don't know, you know, I think, to be honest, to be fair to you guys, the viewers, sometimes you do get the American tax in other countries, right? Not everybody, right? There's a lot of honest people that don't do that kind of stuff, but it is a known thing here that sometimes hospitals will charge you more if they think that you have more of the moolah, right? So be aware of that. Kind of get an idea of what things cost before you go places, because you don't want to get ripped off, especially when you're feeling sick. You know, that's the worst thing, to be sick and then you're getting taken advantage of on top of it. That's crazy, right? That's crazy. All right, so let's talk about that $100 visit, right? Let's forget about the $1,000 visit for now, because we did not do the $1,000 visit. But I went to a hospital. I will give you the name. It was actually called Perpetual Succor Hospital in Cebu City. So this is not a big hospital, but it's also not a government hospital. It's something I would say is in between, right? It's not the big names, but it's not, you know, it's not something that's like totally like a hole in the wall hospital either. It's somewhere in between. So they gave me good care. The doctors were very good there, and like I said, I paid $100. What I got done was I got 2 x-rays. I seen a specialist, cardiologist. I got a quick ECG hooked up, and they did my vitals, right? So when I was there, as soon as I seen them say like, you need 2 x-rays, I was thinking in my mind like, oh shit, 2 x-rays, right? I'm about to get my credit card out and just swipe that bad boy and worry about it later, because I gotta get it done. But damn, 2 x-rays, like, can't I just get 1 x-ray? You know, it's sad that as Americans we have to think like that, because the price of everything is so crazy back home. But when I got the bill, the x-rays were 500 pesos, I think, each, right? So 500 pesos is equivalent to actually a little bit less than $10. So $10 for an x-ray was just like, for me, like, mind blown, right? I was really expecting it to be at least maybe $100. Like, I had no idea. This is my first time here, but based on like American prices, I thought like 100 or like even like something like that would be reasonable. But $10, like, wow, that's amazing, right? So I got all that stuff done, like I said, for $100 total. I was pretty surprised. I was actually very surprised based on my experiences back home. But like I said, not everywhere is going to be like that. It's going to depend on what hospital you go to, and it's going to depend on different factors. But my point, I guess, is that there is affordable healthcare options here depending on where you go, right? And again, I don't know how to tell you exactly where to go. You're going to have to come here and find a place that works for you. But once you do find that place, like I said, there's affordable healthcare options available. Some other quick points I just want to touch on. This is not going to apply to everybody, but even if it can help a few people, it's worth talking about. So I'm not too inclined about this, but I heard there is a VA for veterans here in Manila and also in Cebu. You're going to have to look into that, but if you are a veteran, I heard there's a veterans hospital or a clinic or something, so just check that out. I know it's probably not much help, but it's something to get you started. You know, do the research yourself. At least it's a starting point. And also, I know a lot of people have Medicare and they're wondering if it could work here. Again, Medicare cannot work here, but a lot of people, what they do is if they have an emergency or they have, like, you know, something they need to get done, they go to Guam. So Guam is a country that's about a 4-hour flight from the Philippines, and I guess since it's an American, like, army or something territory, it does accept Medicare. So if you have Medicare and you do have an emergency, God forbid, I guess if it's not too much of an emergency, like if you could fly still, you just gotta get like something done, then you can go to Guam. That is an option. So like I said, maybe not the best option, but it's an option. Alright, so another option is PhilHealth. So what PhilHealth is, it's basically the universal healthcare option here in the Philippines. So PhilHealth is a bit confusing. If there's any expats that are more knowledgeable, or any Filipinos, can you please comment in the comment section if PhilHealth works or how it works for foreigners, because the information is a little bit confusing. You're probably wondering how it's confusing. Well, if you move to the Philippines, one thing you're going to learn is that stuff is not always easy as far as information goes to find a direct answer. Sometimes the websites are updated or not updated, and sometimes the phones don't have accessible phone numbers to call, so you know, it is what it is, right? Not a big deal. But if you move to the Philippines and you marry, you know, a Filipino wife or a Filipino husband, then they will have PhilHealth, which is still going to be helpful for you. The way PhilHealth works is it's going to cover a percentage of your cost if you go to a private hospital, where it's going to usually cover the full bill if you go to a public hospital. So again, it's going to, like I said many times, it's going to vary depending on where you go, but As you can see, that's a theme here. There's going to be price fluctuation depending on where you go. But PhilHealth, basically, it's cheap as like $10 a month. From what I've heard online, again, I don't know if it's updated or what, because the website is quite outdated as far as when it was last updated. But it says that foreigners can pay into PhilHealth too. So if you want to have a little extra help, you could pay into PhilHealth. Alright, so this is kind of a long video, right? But there was a lot of things I wanted to cover. I wanted to be pretty extensive. I wanted to give you guys a lot of options. I've seen on YouTube, or I haven't seen, is there isn't a lot of people talking about this stuff. Maybe it's not the most exciting topic, but it is an important topic nonetheless. So with this video, we went over a lot of different things, and I guess you could probably tell by now that there's not an easy option, maybe, you know, or it's not a simple option, you can say, whatever it is, but there are a lot of options, right? So the best thing I can say is that when you come to Philippines, you know, get checked up, get the big things you have to get done before you come here. Then when you do come, have a savings, bring a safety net. That's very important. And then all the stuff I said in the video, pick what works for you, you know. If you want to get all of them, go ahead. It's kind of affordable, you know. It's not bad. Last year, what I did with the insurances, I did like a little cocktail of insurances, you know. I got the Pacific Cross HMO for if I ever got admitted to a hospital. Then I got the MaxiCare card for just a quick emergency room visit. I had the $1,000 coverage, and then I also had the doctor's appointments through the card, you know. So you just mix and match, you know, whatever works for you, like that. Plus, I had a lot of viewers saying that, you know, they seen healthcare options, you know, and one guy quoted me on email. He was contacting me. So if you're watching this video, bro, what's up? But he was saying $800 a month for his travel insurance or whatever, and I told him, honestly, for that price, just forget it, dude. Just save the $800 a month, because unless you're really like I don't know, like, basically what my point is that if you're spending $800 a month on healthcare, you're gonna be getting a lot of healthcare here, and you're probably not gonna be spending $800 a month on healthcare, so a lot of that's just gonna be going to waste. It's better to put that in your pocket and save it for when you need it, right? Get the HMO here for cheap, get the like I said, the emergency coverage with the card, and then just save the rest in your pocket. So if you have an emergency, a lot of stuff you can pay out here cash. It's not like back home where everything's going to set you back, like little things are going to set you back crazy amounts like that. Like you ride an ambulance back home in America, I know it'll cost you $4,000 or $5,000. It's fucking crazy, you know. Excuse my French, you know, excuse my Tagalog, but you know, I know it's crazy. Here a lot of stuff is affordably priced, so if you're getting quoted for crazy prices, put that in your pocket and just relax, you know what I mean? You're gonna be okay, dude. You're gonna be okay. And another thing I want to say is that I know it's scary, I know it's hard, but try not to let the fear get in your way, right? I know, like I said, I have chronic conditions, like I have anxieties, I have stuff like that, and I know it's fucking scary when you're getting ready again. Excuse my Tagalog, I'm going crazy over here, but I know it's crazy. I know it's scary when you're coming to a new country, you're going across the world. But let me just tell you that once you get here, you settle in, you relax. It's not going to be as scary, you know. It's not going to be as crazy. You're going to be proud of yourself. You're going to feel good. You know what I mean? So try not to let those problems you have back home, whether it's like an illness, you know, if possible, don't let it define you. You know, don't let it get in the way. I know it's impossible with some things, but with others, I guess my point is that I just know how much it sucks, right, to have to like juggle health stuff with like your brain, right? Sometimes your body doesn't want to do the things your brain wants to do, right? Your body's not up for it, but your brain is. You know, I've been there, done that. Or sometimes your brain's not up for the stuff your body wants to do, you know? You can go either way. But you come here, you use those options I told you, it's gonna be okay, you know what I mean? There's good health care here depending on where you're at. I'm sure even in the provinces there's good health care, you just gotta find it. But what I can say is Metro Manila, you know, I've been very impressed with the stuff they have, the doctors, stuff like that. So anyway, thank you guys for watching. Again, it's a long video. Also, thank you guys for all the support. Your boy just got monetized. Your boy just got the partnership on YouTube last video. So thank you guys so much. It was such a, you know, I got here a lot quicker than I thought I was going to do, and it's because of you guys watching, you guys subscribing. I really do appreciate it, because this is what I always want to do, so it means a lot. I'm going to do my best to give you guys all this information about the Philippines, help you guys out, because like I said in my other videos, I know what it's like to be on the other side of the screen watching these videos, trying to figure out what the heck I'm doing, right? So I'm going to be your guide. I'm going to help you guys with that. I'll see you in the next video. As always, thank you for watching. Peace.